Hello everyone, I'm Dr. Swagtesh Speaks. I'm the co-founder and director at Alleviate Pain Management, Bangalore. Today we're going to shed some light on a very common musculoskeletal condition seen in the society known as tennis elbow. Now, tennis elbow or lateral epicondylitis as it is known, it is characterized by pain and discomfort, especially on the outer side of the elbow. This is a part of the elbow where the extensor muscles of the forearm originate from a common extensor origin. The most commonly involved tendon is the extensor carpi radialis brevis. There is degeneration at the attachment of the tendon to the bone, and this weakening brings about greater stresses on the area and leads to progression of symptoms of tennis elbow. Coming to the incidence, tennis elbow is commonly seen in the age groups of 30 to 50 and it shows relatively equal incidence in both gender groups. Any activity which causes overuse or repetitive use of the extensors of the forearm, especially with the palm facing down, can lead to micro tears, inflammation and progression of the symptoms characteristic of tennis elbow. Some of the common activities which predispose an individual to tennis elbow are constant gripping activities like riding a two-wheeler, then constant pushing or carrying heavy loads, then some athletic activities which involves constant gripping action like racket sports, especially tennis. Next, repetitive activities like typing or using tools on a daily basis. Then not very often but sometimes trauma in the form of a direct impact or blow to the lateral aspect of the elbow can lead to swelling, inflammation, degeneration, leading to symptoms of tennis elbow. The most pressing complaint which is commonly seen is a sharp pain at the lateral aspect or the outer aspect of the elbow. There is a point of bony tenderness which is the lateral epicondyle. Activities such as gripping, grasping or pushing can aggravate the symptoms of tennis elbow. The symptoms might be limited to pain only over the lateral epicondyle, or in certain chronic cases pain may even radiate down to the forearm. Usually done by a thorough history and clinical examination, but always our history and clinical examination can be confirmed by imaging such as ultrasound or MRI of the elbow. So first we'll discuss the Mills test. In the Mills test, the patient is in a standing position with with one hand on the lateral epicondyle of the patient. The forearm can be passively pronated, it is extended, and we ask the patient, or we can passively flex the wrist. So this is putting strain on the extensors of the forearm, namely the extensor carpi radialis longus and extensor carpi radialis brevis. If this brings about pain on the lateral epicondyle, the Mills test is positive and indicative of lateral epicondylitis. The next test that we want to discuss is the Cosen's test. We'll ask the patients to sit down. In a seated position, the patient's arm is extended. The examiner can palpate the lateral epicondyle. Then it is brought about into pronation. Then a little bit of radial deviation. Ask the patient to make a fist. And little bit of radial deviation. Now ask him to lift the wrist against your resistance. If this produces pain over the lateral epicondyle, the Cosen's test is positive. If these two tests are positive, it is a strong indication that the patient is actually suffering with tennis elbow or lateral epicondylitis. Initially, a conservative approach is started by limiting the offending activity such as gripping or typing. Followed by limitation of the activity, patient can be started on anti-inflammatory medication. Patients can also be given manual massage, ice massage, and modalities like ultrasound can be used to soothe the painful symptoms. Tennis elbow braces and splints are also popular in restricting the strain on the extensor muscles. The age-old infiltration of the inflamed area by corticosteroids. Now, this is practiced in a blind fashion, or some of the practitioners use image guidance to administer corticosteroid to the inflamed area. This brings about relief of symptoms, and then patients can be also put on a rehabilitation program following these injections. Care must be taken not to give successive injections at the same site when it comes to steroids. Discussing the exciting treatment modality of platelet-rich plasma in prolotherapy, it has been seen, and we have also seen in our practice, excellent results in treating patients with this modality. So we also favor regenerative modalities like PRP with prolotherapy because this brings about healing of the injured tendon. It needs at least 2 to 3 settings of PRP and prolotherapy to bring about healing, and we really emphasize on coupling this treatment with a structured exercise program. Stem cells are slowly but surely finding their entry into the treatment of musculoskeletal conditions, and tennis elbow is no different. In some chronic cases, stem cells have been tried with good effect. Now, cases which are chronic and resistant and are not responding to non-operative or conservative means generally find themselves in front of the surgeon, and the surgical options include an open or arthroscopic approach, which involves removing of the damaged and degenerated tendon to bring about pain relief. Now, a good structured exercise regime is of paramount importance in treating the patients of tennis elbow. Some of the common exercises that are given to patients suffering with tennis elbow include forearm extensor stretch, eccentric extensor strengthening of the wrist, isotonic extensor strengthening of the wrist, and isometric extensor strengthening of the wrist. If you or any of your near or dear ones are suffering with pain, please reach out to us at Alleviate and give us a chance to help you alleviate your pain.